Now we have Dr. Sophocles Voineskos. Dr. Voineskos is a plastic and reconstructive surgeon at the University of Toronto and an investigator at the Li Ka-shing Knowledge Institute. His research interests include patient education and using patient-reported outcomes to improve patient satisfaction. His presentation is titled Recovery Following Breast Reconstruction. Welcome, Dr. Voineskos.
Thank you very much. It's a pleasure to be here. There are a number of components to recovery. And I'm going to focus on what patients have told me are the big categories in the short term, which you can think about as maybe the first month or 2 or 3. And these would include pain, medications, wound care, activity restrictions, and garments. And these things are common to both major reconstructive types of implant and flap. And the long-term recovery you can think of as being more like 3 to 12 months, but even beyond 12 months, as you'll hear from a lot of people who've gone through this. And these include the potential for pain, breast numbness, scarring, psychological, and social recovery. For the short term, right after surgery, the chest will be painful. And also many patients report almost like a whole body fatigue as well. And it's not possible to avoid surgical pain, but ideally with medication, we can get your pain to around a 2 or maybe 3 out of 10. In terms of medication, I would definitely recommend some over-the-counter medications such as, Tylenol in addition to any narcotics. And this will help a lot to decrease how much narcotics you actually need to take. Most surgeons often recommend some stool softeners and antibiotics. And then there are potentially others, for example, nausea medications, muscle relaxants. It really depends a bit on your surgery, on you, and the surgeon as well. Most surgeons use sutures that do dissolve on their own. And unless your surgeon has given other instructions, leave the bandages on. Plastic surgeons can be quite picky. And I'm not going to get into hygiene details like when to shower or take a bath. Please ask your surgeon because they're very particular about this stuff. Most people use drains, and you will get some teaching on how to use the drain and take care of it and measure how much comes out. They're usually there for about a week or 2 if you have them. And when the drainage is less than about 1 ounce, then in a 24-hour period, then they do get removed. Again, your surgeon will give you instructions, but a good rule of thumb for activity restrictions in the first few weeks at least is not to move your arms past your shoulder height, not to lift more than 5 pounds. And I would advise sleeping on your back if you can, so there's no pressure on the reconstructed breasts. Some common questions we get asked regarding activity. When can I go back to the gym? Usually around 6-ish weeks. Again, check with your surgeon, but for sure during this time, avoid any strenuous exercise or jogging or other activities like that. When can I drive again? So you can drive when you feel comfortable to and you feel like you can react quick enough. But in general, most patients tell me they feel around kind of 2 or 3 weeks after surgery, they feel like they can drive again. Please do not drive if you are taking prescription pain medications, though. Double check with your surgeon for this one, but wait at least 2 weeks before engaging in sexual activity. You do want to give your body some time to recover, the wounds to start healing. It's really important not just to feel physically ready, but emotionally ready. So for many patients, this is going to be way longer than 2 weeks, but I would say this is like the minimum. Postoperative garments. So if you had surgery taking the flap from your tummy, so the DIAP, the autologous, you will have an abdominal binder, and that helps provide support to your core muscles for about 6 to 12 weeks or so. The company pamphlet photo looks like this, but in reality, this is what the binder looks like, and there's a bunch of drains pinned to it. For bras, ideally avoid a bra with an underwire. We recommend wearing a soft, supportive bra that's frontal close. Many surgeons recommend compression bras. Some of them can be expensive, so you can also wear a sports bra if you prefer. And around 6-ish weeks later, you can start to wear a regular bra again. So long-term recovery. So to be fair, these things are all happening in the short term as well. But after a few months, these issues start to become more of the focus for the long-term recovery phase. Now, the surgical pain does go away, but persistent pain lasting more than 3 months after either the breast cancer surgery or the reconstruction, unfortunately, is common and can affect around 1 in 3 patients after breast cancer surgery. And the average pain intensity reported by these patients is around a 4 out of 10. And if you are experiencing this, please let your healthcare team know. The cause of this pain isn't really well understood, but it is thought to be related to the nerves being cut through during the surgery. It's just not possible to remove the cancer in the breast without cutting through nerves. And another consequence of nerves being cut during surgery is breast numbness. So most patients do lose feeling in the remaining breast skin there, and some patients lose feeling in the armpit and potentially inner arm, especially if lymph nodes have been removed. So related to this, both the breasts and potentially other areas, like if you took tissue from the tummy, can feel pretty numb, and be careful. I'd actually advise avoiding using heating pads at all, because this can either burn or harm your skin. The good news is that over about 1 or even 2 years, some of the nerves do grow back in, and you might get enough feeling to feel some hot and cold temperatures and maybe some sharp or at least deep pressure. Scars. So there's no way to do these surgeries without putting scars on the body. Sometimes they can be quite well hidden under the breast. It does take as long as about a year or so for tissues to fully heal and scars to start fading. Scars never fully go away, but usually turn from a pinkish reddish color in the first few months to being less obvious over time. You can make them look nicer if you start doing what we call scar massage around the 4-week mark. So this is rubbing directly on the scars with some oil or cream every day, 5-10 minutes a day, multiple times for a month or 2, avoiding any exposure of the scar to the sun. And if you do know that you scar poorly from past surgeries, for example, or if you get keloid scars, then I do recommend silicone gel sheets. So breast cancer is a stressful and can be a traumatic event as well. And after the cancer treatment and the reconstruction is completed, there's often persistent psychological and social issues. Feeling lonely or isolated is common. You might even feel lonely surrounded by family or friends. And some patients do worry about their cancer returning. Others report difficulty returning to their daily tasks or even just going back to work. And all these things can result in stress or increased anxiety or depression. And it can be hard to talk about having cancer, hard to talk about going through breast reconstruction. It's very hard to do this on your own. So having a support system is important. Some people do find it helpful talking with family and friends. Other people don't. Talking with other women who've had breast cancer and breast reconstruction can be helpful, like bra day. And if you are experiencing anxiety or distressing feelings, then talking with a mental health professional can help. So recovery is not easy, and I think a lot of patients are surprised by how long it takes to feel somewhat normal again. I find it can be a little bit patient dependent, but on average, the majority of patients tell me it took them around 3 to 6 months or so before they felt like they returned to a somewhat normal life, but it can take much longer in some patients. Thank you.